मेरा नाम दिनेश चंद अग्रवाल है। मयूर विहार में नई दिल्ली में रहता हूँ। मुझे बॉम्बे और चेन्नई जाना था अर्जेंट काम से। प्लेन में हमारे पास में एक लेडी बैठी हुई थी। मुझे उस पर डाउट हुआ, मुझे लगती है कहीं बीमार ना हो। चेन्नई में और मुंबई में दोनों जगह मुझे खांसी का बहुत जोर का अटैक हो रहा था और टेम्परेचर था। तो टेम्परेचर में मैं कॉम्बी प्लान खा रहा था। टूर में टाइम इतना नहीं था कहीं दिखा सके।
On my Sunday morning in Canada, I got a call from my cousin that the father has been admitted to the hospital. So he told me that he is in ICU. So without thinking for a second, I booked my tickets and flown back to India on Monday. And then doctors told me that when he was traveling to Bombay and Chennai, he got this disease of swine flu, which has actually damaged his lung and caused a respiratory failure.
Dinesh Chandra, who was the patient of swine flu pneumonia and a severe ARDS, which we transferred from another hospital for the need of artificial lung support, which is ECMO. ECMO stands for extracorporeal membrane oxygenation. So the patient was brought there with a severe respiratory failure and had a double pneumonia. So both lungs were involved with the pneumonia. Despite the best support on the ventilator, his oxygen saturation was around 80% only. So for these patients who require a very high amount of oxygen support and still not having adequate saturation, the next line of treatment is prone ventilation. So the patient was prone at that hospital. Despite proning, his oxygenation wasn't improving. So the family approached us and the team from another hospital approached us for the need of ECMO or artificial lung support.
This machine is actually a centrifugal pump. It's what we cardiac surgeons they use in the operation theatre, that heart lung machine. It is one of the pumps of heart lung machine. It contains one oxygenator and one pump, and the cannulas are put one in the leg and one in the neck, and the one cannula which is put in the leg takes out deoxygenated blood, that is called dirty blood, and then it cleans it, gives the oxygen, removes the CO2, and then we put it back into the body. As the circulation is 5 liters per minute, so we keep it 5 liters per minute. So most of the blood oxygenated, and it actually function as an artificial lung.
So in these patients who got a severe ARDS, what they need is some time for the lungs to improve and also adequate oxygenation to the body tissues so that they don't fail. So this machine itself is not a treatment. What it does for us is buy time. Of course, it comes at a cost, but the family support is also important, and the family need to be communicated at all the times that this therapy is helping him. Most of the time what we do in these situations, keep the patient awake so the family gets the confidence that the patient is getting better, and with time, after 7 to 10 days, when we see the lung recovery.
And both the doctors has been highly supportive. They have motivated me and my family and informed me each and every detail of his disease on a daily basis, to me how he has been recovering. And I really feel happy that my father is back with me now, speaking to me totally in his senses, and I'm hoping for his fast recovery. Both the doctors, Dr. Keval Kishan and Dr. Rajkumar, are nothing but the representatives of God to me.